moving forward for this. So my presentation outline is about the process and the results, the agreements made, and the proposed research agenda, stakeholders' appeals and refinement of the research agenda if necessary, prioritization criteria, and scoring. All of these processes wants to ensure inclusivity and also participation of all stakeholders needed to basically formalize or finalize the research agenda. So next, so based on the PNHRS system, we define the context in our region first. We conduct information gathering also, and we wanted to have it more inclusive. That's why we invited several stakeholders from the regional to local levels, even from RHUs and even from program managers at the regional level. Also, we do have stakeholders from the academe and other network members of the EVHRDC. Yesterday, we generated the initial list. Actually, this initial list, that's why it took time po kasi 151 raw data we need to analyze. And then choosing the criteria, which is today. Actually, last 2017, we wanted to recommend that we will use the same criteria we chose to basically prioritize everything, because we wanted to maintain that our research agenda is basically aligned with the previous research agenda and also responsive to the needs of the localities, or even the needs of the region, priority health needs. So our limitation po basically is this one, reporting the prioritization. It's basically the role of the RAMC or the EVHRDC as a whole, and then they will disseminate everything to their stakeholders in the region. So magpo-pause lang po tayo sa deciding the research priorities. Okay, moving forward, this is our guideline for the research prioritization. First, we wanted to ensure that all stakeholders were engaged. Next, we wanted to pose reflective questions whether or not we need to basically update our research agenda using 4 parameters based on the guidelines. Number 1, epidemiological landscape. Number 2, socioeconomic landscape. Number 3, political landscape. And lastly, health policy landscape. This will serve as our justification to update the Regional Unified Health Research Agenda. So to objectively see whether or not we need to update the Regional Unified Health Research Agenda, here's the results. So the unit of measurement is in percentage. There are 27 respondents and 16 of them registered in our Mentimeter plus the chat group. So percentage of strongly agree plus disagree, and percentage of strongly agree and agree. And then actually, so if you can see po, most of the respondents said that there are changes in the epidemiologic, socioeconomic, political, health policy environment. And those changes were significant enough to call for the updating of the Regional Health Research Agenda. As justification, so basically, ito po yung justification natin. That's why gagalawin natin ang ating Regional Unified Health Research Agenda. So moving forward, this is our process. So we have a survey on 4 parameters, or actually yung sinasabi po natin kanina. We use descriptive data for the analysis, and we approve the recommendation to update the Regional Unified Health Research Agenda of Eastern Visayas. So moving forward for the updating. For the updating, actually there are 150 codes that or raw data we need to check on. And then after analyzing all 150 raw data, I coded 31 topics or thematic areas. And then after coding after coding all the 150, I checked its alignment with the NURA and the RUHRA. Next, the layers to produce the recommendation is based on the results. And there are 3 new codes. Number 1, immunization, which is basically because of COVID-19. There's also school health to check on the health of the children, school-aged children. Also, there is innovations in health. So for the first layer, there's a need to really check whether or not kung may makikita tayo, even words lang po na hindi magkakapareho, hindi po natin siya tinatag na aligned. So basically, dito sa first layer of analysis, kapag pareho po yung ginawa natin na coding with the NURA and also the RUHRA, we automatically adapt the code so that will be included in the 31 code, generated code. The second layer is we check on the NURA and RUHRA, and then doon po sa code natin, we revisit the context of each code. So basically, we wanted to check whether or not nandun nga ba siya sa NURA or RUHRA. And then, if nandun nga siya sa NURA or RUHRA at pareho ang name niya sa NURA at RUHRA, we adopt the NURA and RUHRA code or the thematic area or focus. Moving forward on the third layer of an analysis or third layer of recommendation. For example, the first code, my code, is basically aligned with the NURA and RUHRA. However, there are changes or parang magkakaibang words na ginamit pagdating sa coding. I adopted the code from the NURA or the RUHRA. However, based on the analysis, to maintain faithful or to become more faithful sa ating regional unified health research agenda, we adopted kung ano po ang nasa existing na RUHRA natin. Kasi po naka-define naman kung ano ang ibig sabihin ng thematic area na yon. Now, if we have new code but it is aligned with the NURA or RUHRA, it's either of the two. Titignan pa rin po natin kung ano po yung pwedeng i-adapt. So basically, kung hindi RUHRA ang inadapt, NURA po ang code na inadapt based on its context. So number 5, the new code. New code meaning that the code does not appear sa NURA and RUHRA. So pareho po natin siyang inadapt. Ano po ang ibig sabihin ng new code? It can be a priority sa ating Regional Unified Health Research Agenda, pero nakikita din po natin na kailangan siyang ma-emphasize. For example, that's immunization. However, saan po ba siya papasok sa ating NURA or RUHRA? Sa NURA natin, pumapasok po siya sa health service delivery. Pagdating naman po natin doon sa ating RUHRA, service delivery ang nakasulat. So basically, we adopted the immunization. However, in the final recommendation, we always adopt the RUHRA because basically that's our basis on updating. So we will present to you the process. So we have 3 ways of collecting data from you. One from the chat, the first one from the survey, second one is from the chat, the third one is from Mentimeter. And then we do preliminary coding and then checking of its alignment and then formulation and finalization of the codes plus the appeals process today. And we will recommend the updated health research agenda. So moving forward, this is your Regional Unified Health Research Agenda. It has 21 topics in the list or thematic areas. So hopefully mabasa po natin siya lahat and hopefully everyone is familiar with the Regional Unified Health Research Agenda. I'll read through it lang po because it's basically important for us to realize kung ano po ang research priorities natin. So number 1, health service delivery, communicable disease, maternal and child health, health technology development, healthcare financing, health governance, health knowledge management, environmental health, lifestyle diseases, disaster risk reduction and management, and climate change adaptation, reproductive health and family planning, nutrition, mental health problems, and health infrastructure, traditional and alternative medicine, health promotion, health regulation, drugs and substance abuse, gender and development, geriatrics, and disability. I read this to you po kasi of all the 21, ang natanggal po dito sa ating Regional Unified Health Research Agenda that was created last May 2017 were drug and substance abuse, gender and development, and disability. For disability part po, although nakasulat po siya doon sa ating survey or ating Mentimeter, yung disability, ang context po niya ay pumapasok sa disaster risk reduction and management in health and climate change adaptation plus service delivery. Basically, we wanted uninterrupted health services during emergencies or disasters. Kaya po siya na pumasok doon rather than having it stand alone. So with regards to the recommended health priorities for 2021, ito po yung lumabas. From 21, we now have 26 research priorities. From 21, we have now 26 research priorities. Yung naka-red po dyan, basically, that's adopted from the Regional Unified Health Research Agenda. Yung naka-black po dyan, that was adopted from your National Unified Health Research Agenda. The ones in italicized form po or italicized po, ito po yung dalawa na hindi po na bagong code sa ating research agenda. At this point in time, I will open the floor to everyone po to comment on the process and to comment on the recommended health research agenda. So baka matulungan po tayo ng secretariat kung sino po ang magre-raise ng hand para po sila ay ma-recognize. Thank you. Baka we have from Ramsey and then from stakeholders from LGU po. Thank you. Meron po bang comments sa process? Or pwede po bang magtawag, Ma'am April?
Hello po, good morning.
Yes, ma'am.
I'm Marian from BIPSO po. Based on the process that you did po, sir, I think it was very well explained, and there was really a step-by-step process, and the thematic analysis that you did was for me okay. So I have no suggestions or for its improvement because it follows the standard, and it is very clear and concise. So that's for me, sir. Thank you.
Thank you, Ma'am Marian. May we have representative from Ramsey because they are going to monitor the 26 research agenda, the updated one.
Sir Ted, si Sir Ding Alobia.
Hi, Sir Dean. Good morning po.
Okay, good morning. This is my latest observation. Actually, I would have I have a different comment actually, because this is directed for sabagay sa research agenda kasi yung iniisip namin yung paano kami makakuha ng yung research question na that is really more specific in nature, kasi masyadong general ang research agenda pala eh. Parang you're just given the title, the topic, I would have preferred kung in my own observation, kasi very broad yung nakalagay eh. Parang sana kung pwede, research question talaga. Kasi para sa research naman ito eh, hindi naman ito for other purposes. Although you mentioned the factors, you mentioned earlier na yung political one, ano ba yan? Political
landscape, epidemiological landscape.
But anyway, this is just a personal comment, but anyway, this is still a standard. This is a standard format that we are following nationwide. So, for now, as the modifications that you introduce, okay lang naman. Pero ayun nga, yung I would have preferred sana for the next few research question na talaga yung lalabas na Kasi yung like yung issuance from central office ng DOH, meron silang specific research questions for universal healthcare. Mas makikita mo talaga doon ano yung kailangan na kasi ito masyadong broad. Wala kang parang hindi sa agenda yung kwan eh. Pero anyway, lang naman ito is this is a standard. So at the moment this is the standard So okay lang sa akin yung yung additional na na ibigay mo format. Thank you very much po.
Thank you very much. So we have question from Doc Kat. Hi Doc Kat, you can unmute po and have it.
Hello.
Morning, ma'am.
Ay, good morning po. Oo. Tanong ko lang kasi kung yung universal healthcare, saan ba siya papasok? Or naka-divide na siya kung yung papasok siya na may kinalaman sa service delivery, health financing, ganun ba siya? So, wala nang separate na about UHC lang talaga.
Okay. Thank you for that question, ma'am. So for the universal healthcare po, it is under health economics and health financing, not on service delivery. Why health economics and health financing? Because the two is basically magkaiba po talaga siya. And sa financing, it's basically financing a program or your investments. But on economics, you are going to check whether or not your interventions or your policies is effective enough, and is it cost effective? Is it cost beneficial to the stakeholders or to your locality?
Yung take ko lang kasi actually UHC, yes, kung sa category niya nasa health financing siya, pero when you really think about universal healthcare, it's really about access, 'di ba, to health services, to quality health services at the time of need wherever they are. So medyo part of it would also be under service delivery, 'di ba? Kasi
Yes,
yung
ma'am.
mga yun lang. Pero kung nandyan na siya, pasok na siya dyan, okay lang naman. Pero parang mas naano ko lang sana nun kung meron talaga ding UHC na separate na about universal healthcare. Kasi diba eventually, doon naman din talaga kasi yung direction natin.
Opo.
Ayun lang.
Ma'am, to add din po kasi kaya po siya nahiwalay for health economics and health financing is basically yung question or yung input is doon papunta kaysa papunta ng service delivery. Although we acknowledge during the presentation ng MITRA or the medium-term health policy and systems research wherein we emphasize po UHC, pumapasok po talaga ang service delivery. If I may share lang po, I'll stop sharing muna nito and I'll present lang po the the raw data. Makikita po natin na sa NURA, inihiwalay talaga nila yung mismong access to services. So, ihiwalay ko lang po siya dito. So, and then, tapos, ito. Ayan. So, nakasulat po dito, like for example, free medication and check-ups, telemedicine, nakasulat siya sa access to essential medical products, vaccines, and also technologies. I think EVHRDC after this meeting po, if we can finalize the priority research agenda or the regional unified health research agenda, they can share the raw data with you, with the stakeholders present today. Thank you. So I'll be going back lang po sa presentation. Nagtataas ng kamay si...
Sir, can I interrupt for a while? Si Sir Dean
yes,
po
sir.
ito. Yung sinasabi mo kaninang recommended health research agenda, yung slide mo kanina,
Yes.
is this the recommended health research agenda for Region 8? Ito ba yun?
For Eastern Visayas.
For Eastern Visayas. Okay. Thank you.
May
Sir, okay.
yes. Ma'am Marian, yes po.
This is in relation to the comment of Dr. Olobia. I think there is merit in what he is saying. For the most part, because in the HNRDA, for the ones in black, there are already specific niches. If you say something specific under the research agenda, these are called niches. So under the HNRDA, there are already specific niches that we need to pursue for until 2022. For example, in functional foods, there are identified functional foods that we can do research on, such as turmeric and the likes. There is a list in HRDA. So for the comment of Dr. Olobia, I think that it would also be better for us to identify niches, same as in the HNRDA, for those that are new codes and for those that are only true to Eastern Visayas, because it would be better given that when we propose research for funding, or when we try to do baseline data, this will come in handy to guide researchers on the specific direction that we will take, given that the thrust is the main or should we say the one that DOST looks into when they initially evaluate your proposal, because the niche can either, your thrust can make or break your research proposal. Kasi if you don't have the right thrust, you're automatically rejected kahit pa maganda yung sinulat mo. This is the number one source of rejection for us researchers. So I think there's merit to what Dr. Olobia is saying. For the most part, for those for the research agenda that are only true to Eastern Visayas, I think it would be better if we can identify specific niches for this year or in the next 3 years that researchers can pursue, especially for those new codes and for those research agenda that are true only to Eastern Visayas. So that would be my take on Dr. Olobia's comment po. Thank you.
Ted, tinawag na niya akong doktora, kahit di ako doktora.
Sorry po, sir. Sir Olobia.
Ma'am, yung, ano po yung HNRDA?
There is the Harmonized Research and Agenda of DOST. It's there is
Okay.
kasi for every year, DOST identifies the research, particular niches that we can pursue. Example for
meron akong I was not able to focus yung lecture couple dahil meron din akong activity. Pero ma'am,
yes po.
may just comment a little more. I think you are correct with that. Bali parang lumalabas lang siya na topic, mother topic. Tapos yung mga laman, yung mga research
niches po, sir. Yes,
niches ay nasa loob na. I think that's much better. Mas maganda yun kasi makikita kung ano yung mga specific niches or research question sa loob ng theme.
Yes po, sir.
Tama ba yun, Sir Ted? I think that would be better na if that's the suggestion is acceptable.
Yes, sir. Actually, as mentioned po, ang purpose ng research agenda is first to become, ito po sana ay, ang agenda sana natin ay broad enough to cover for the interest of the health researcher. Pero po, dito, pwede rin po nating lagyan per research agenda. Like for example, health service delivery. Mag-specify na tayo ng topic na yun yung uunahin nating pontuhan kapag may nag-propose doon. And actually, for every region na ginagawan po natin ng updating ng RUHRA nila, yun na rin po ang request nila so that may taker na nung topic. And that will be based on the solicited inputs from the stakeholders. Actually, kung iisa-isahin po natin yon, 150 po yung pagbobotohan natin kaysa po sa 26. So, may I recognize po, Sir Marvin? You are raising your hand po.
Hi, good morning everyone. Good morning, Sir Ted. I'm Dr. Soledad, the Medical Officer of UP Tacloban. So I'm asking lang din in relation sa mga napag-usapan kanina. Specifically on school health and occupational health. Hindi kasi ako naka-attend yesterday. So I'm curious kung paano siya nasama, specifically kung anong topics under the agenda of school health and occupational health.
In terms of school health po, that's basically the children going to school, and actually mas yun po yung binigay na topics or mga inputs. For occupational health, ang lumabas po doon is how do we ensure occupational safety and health during especially during the pandemic. Actually po, hindi po lalabas ang occupational health if we adopted the NUHRA definition wherein papasok po siya sa disaster risk reduction and health emergencies. Kasi po ang context po ng question or ang context ng input ay nasa context ng health emergencies rather than context of occupational health.
For the school health, you mentioned children. So, pediatric age group, hindi kasama yung...
Yun lang po kasi yung naibigay na input, sir.
I see. Okay, thank you.
Any more comment? So basically po, kaya po natin pinapresent ang research agenda kasi we heard comments from everyone naman na po siguro, and any more pa po from LGUs and even program managers ng Department of Health or academic partners, meron pa po ba? Okay, if wala na, we will proceed with the appeals process. Why do we need to have this appeals process? Based on the guidelines of the PNHRS, we need to really check on the consensus of everyone whether or not we will adopt this as is or we wanted to modify accordingly. So it is recorded naman po. So every context of the appeals will be noted and will be documented for tracking purposes. So wait lang po, I'll be opening the floor to everyone so that you can provide or motion for the appeals process if ever na kailangan po natin may emerge or may i-modify. Ito na po yung first workshop natin wherein everyone is free to raise your hand and be recognized so that you can provide inputs on the appeals process. So, thank you very much. Sino po ang gusto mag-open ng floor for the appeals process? Anyone from the group? We are 23 here.
Sir, may I appeal po? Sir Dave.
Yes, sir.
I would like to consider the COVID in the agenda. So maybe we can put sa theme emerging and re-emerging diseases para dun siya papasok.
Ito sir, dito sa communicable diseases.
Actually kasi yung communicable diseases, yung even sa programs, ang laman diyan yung mga yung mga endemic tulad ng cysto, malaria, TB. Ang kasi COVID, siya nasa emerging diseases kasi siya So I would prefer it to be placed in separate
Okay. So magdadagdag po tayo ng isang Sige po. Aha. Mag-insert lang po ako ng column ay ng row below. So at i-read ko lang po siya.
May I just comment lang sir yung kanina yung kay Dr. Soledad yung sa UP Tacloban kanina na school health kasi you were saying about this is for children. Kasi
Yun po,
ang mga kinikater namin ng mga diseases to children, dengue, salt transmitted helminthiasis, yung deworming, siguro sa papasok siya dyan. Pero I think it would be if you're saying that this is specific for children, maybe school health for children ang ilagay natin para we are more specific. Kung hindi man ito nagre-refer din sa sa adult. Kung para sa children nito, ilagyan na lang natin na for children. Would it be maybe that's more more appropriate.
Okay, thank you for that comment, sir. We inputted po school health for children kasi ito lang po yung pumasok kahapon, and then emerging diseases, especially COVID-19. But basically po, yung communicable diseases like COVID-19 is nakapasok po siya sa communicable diseases na category. Actually, in the first coding, it is infectious and communicable diseases. And also, nakapasok dito, emerging and re-emerging diseases. So, Dr. Lim,
Emerging and re-emerging.
Dr. Lim, you are recognized po. Aha. Sa chat
Sir.
box, yes po.
Considering those that you mentioned also about re-emerging, infectious, and communicable diseases, they belong to one.
Actually.
They belong to one group.
Actually, sir.
Okay, thank you.
Actually, sir, doon sa first code, ang nakalagay sa NURA natin at RUHRA natin, communicable diseases. However, doon po sa code na ginawa ko na before ko siya i-align with the NURA and RUHRA, ang nilagay ko infectious and communicable diseases. So under po nun ay emerging and re-emerging diseases. If we wanted to really focus on COVID-19, so actually po, doon sa NURA natin, which is not here sa disaster risk reduction and management and climate change adaptation, dun po kasi sa NURA, in-specify po niya disaster risk reduction and health emergencies. Health emergencies includes pandemics and even outbreaks. So what's the pleasure of the group, or what's the pleasure of the group kung ano po yung dapat nating i-modify dito? Any comments from the stakeholders? Dr. Lim, gusto po ba natin na isama siya sa communicable diseases, infectious and communicable, yung emerging and re-emerging? Or dito po, ang i-adapt po natin ay yung NURA na may health emergencies so that it will include pandemics and even outbreaks?
Okay, if we have that already in the NURA and then RUHRA, then we can adapt it like that.
Thank you for seconding the motion po para sa emergencies. So ilagay ko lang po ito ay nasa RUHRA na. And then mag-note lang po ako dito na ito ay will include emerging and re-emerging. So magpapaalam ako, Sir Ding. Okay lang po ba na dito na lang po siya ma-under?
Actually, this is my opinion. When we are speaking of disaster risk reduction, this is actually related to health response, health preparedness, and it does not always cover diseases like emerging. So yung mga typhoon, response to typhoon, earthquake, yun po yung coverage ng disaster risk reduction. So yung diseases talaga, kung isasama mo siya, mas maganda isama mo na lang siya dun sa communicable. Kaya ako sinasabi na hiwalay sila because in even our public health program, the emerging and re-emerging diseases is not part of the sa communicable. Pero mas maganda kung isa pa doon na lang siya sa communicable kasi yung disaster risk reduction is really more on disaster mitigation, preparedness, mitigation, response. So parang inappropriate yata yung diseases pumasok doon.
Okay, noted on that, sir. We will refer to the policy kapag naglagay na po tayo ng context dito sa bawat bawat thematic areas na ito para po mas malinaw at pare-pareho rin tayo ng understanding. Thank you for that. Tanggalin ko po ito dito. May comment po si Dr. Kat. Doc Kat, ang sabi niyo po kanina about UHC, can you emphasize or further elaborate if ever po na need? You can unmute po. Ay, nawala pala. Nag-re-enter si Doc Kat.
Sir, if I may share na lang po in behalf of Dr. Kat kasi medyo din ako sa yung UHC kasi is more on health systems. Kaya nga iniisip ko, itong mga themes on health financing, health governance, health regulations, these are health systems. I don't know kung kasi masyadong marami na. Siguro, I don't know if this can be lumped into health systems research or health systems kasi ang pasok siya sa health systems building blocks. So doon pumapasok na rin yung yung universal healthcare kung ilagay natin yung health system. So under doon papasok na yung health governance, health regulations, health financing because these are components or building blocks of the universal healthcare.
Noted on that. So ganyan po ba, sir? Health systems development?
Pwede, health systems development. So tatanggalin mo na yung health governance, health regulation, health financing.
Okay.
Kasi pasok siya dun sa health systems. These are components of the health systems. Even the health human resource. The health human resource, hindi siya pumapasok sa health system ng Philippines, pero pasok siya sa WHO. Maybe because this is for the Philippines, we will just put the health human resource as is. Kasi it's not part of the of the health systems building blocks ng country.
So basically, sir, you're suggesting...
No, not the economics kasi wala namang economics doon eh. Financing lang. Financing, governance, health regulations, these are...
And regulation.
Sa bagay, ipa-follow natin yung WHO na yung health human resource, pumapasok kasi siya sa health systems eh. Pwede rin kasi sobrang dami na sila eh. They are all components of health systems development.
How about service delivery, sir?
Service delivery is another part. Yeah. That is also a part of the health systems.
So pwede natin siyang tanggalin dito. Health regulations din, no, sir?
Yeah. Oh.
Opo.
Sa Formula 1 ng Department of Health, lima yan. So, health governance, regulation, service delivery, health financing, performance accountability. Pero sa WHO, pumapasok doon yung human resources kasi hindi siya inabsorb ng DOH na as part of the health system. But anyway, this is encompassing health systems pa rin. I would prefer it like that para hindi siya sobrang dami na
Okay. Maybe,
I don't know with the others, but this is my opinion.
thank you, Sir Ding. May we have Dr. Kat? Para sa UHC daw po, we can have it lump as one for health systems development like financing, governance, regulation, human resource, and service delivery. There's Ma'am Gloria po na yes, na sub na lang po yung ibang group so that mas kaunti ang ating pagbobotohan later. So, Sir Nap, you're recognized po.
Hello, good morning everyone. I am Napoleon Moron from the DOH Regulations Licensing and Enforcement Division. My comment is on school health. I can actually get the point of Sir Ding on school health for children when usually po kasi di ba yung ginagawa natin is for sabi niya yung mga helminthiasis and so on so forth. But when we say kasi school health, I think it is very much encompassing. So we may not only focus on children, but like for example, for high school and college, we can actually observe that there is increasing number of students who commit suicide. So it may actually include parang mental health for students, especially also at this point in time na meron na pong the advent of other modes of yung schooling is especially yung online, modular, and so on and so forth. So how does it affect to the health of the students as a whole? Parang ganun po. So I think school health hindi lang po for children, para sa akin lang po yun. Yun po, that is very much encompassing po. So marami pong topics na pwede nating i-include sa school health. Ganun po.
Thank you, Sir Nap. May we ask Dr. Marvin, is that okay po even though the input is for focus on children, is that okay na make it more general so that it can include other age group? Sir Marvin?
Hi. Actually, I was thinking about the same thing because hindi lang naman yung children yung may problems. School health is very encompassing. But hindi lang ako nag-comment kanina because I thought that since yung tinanong ko kanina, sabi mo na yung children lang yung pumasok dun sa input, that we can do that. So, yun
actually, this appeals process po, just to clarify din po, you can always provide inputs to modify the research agenda so that mas mag-fit po siya sa regional na stakeholders.
So with that, dapat kasi hindi lang talaga for children. For example, in my experience here in UP Tacloban, we're observing increasing dropout rate. So maybe we should perform studies on that also. So with that, tanggalin na lang yung for children para lahat na lang.
Thank you, sir. Thank you for that. Nag-comment si Dr. Abiartas. Dr. Abiartas nag-yes po with Dr. Soledad. Doc Kat, nagtanong po kayo kanina about UHC and na-disconnect po kayo. So the proposition of Sir Ding is basically to have it on a health systems development, which includes financing, governance, regulation, human resource, and service delivery. It was seconded by Ma'am Ma'am Gloria po, Fabregas. What's your take on that po, Dr. Kat? You can unmute po. Doc Kat, naka-mute po kayo. Sige po. While waiting, Sir Nap, naka-raise pa rin po yung hand. You wanted to say something po?
Ay, no po. Yun na po yun. Thank you, sir.
Thank you po. So, is there any more comments? We are 10:32 and we took time din po para dito. So, why not include...
Sir Ted,
Yes po.
yeah, Dr. Please. Maybe we can include dun sa health systems development siguro dagdagan na lang natin ng and universal healthcare. Kasi
Okay.
universal is very broad. Dun sa health system and universal health. No, hindi siya part ng dun sa health systems development and universal healthcare. Doon mo siya ilagay.
Noted.
Para pasok siya diyan. Another concern lang, saan ba pumapasok yung mga disability disorders like autism, mga
Ang naging context po kasi noon is pumasok siya dito sa disaster risk reduction on how to ensure services during disasters. So,
Pero
pumasok siya dito.
Hindi siya pumapasok din kasi may anak akong may autism, hindi naman sa disaster yan eh. When she was 2, she had already, kasi supposedly sa mental health problem siya, pero parang kulang. I don't know kung pumapasok siya dyan sa
Actually po mental health din
yung
naman siya.
disability disorder. Sa bagay, kung pumapasok siya dyan, okay. Yung mga yung mga pwede naman. Sige, okay.
Thank you for that, sir. Ma'am Gloria, you can unmute po to basically contextualize road traffic injury.
Good morning, I'm Dr. Gloria Fabregas from the City Health Office. Kasi parang lately, tumataas talaga yung road traffic injury natin. So, it's been marami ng advocacy on that, but there was no solid research on road traffic injury. That's one. And then second, siguro, mas magandang tawagin siyang mental health issues rather than mental health problems. Stigmatized na kasi ngayon yung I've been receiving a lot of referrals also. Ito na mga modular na yung mga bata nagkaka-depression, nagkaka-anxiety. So, lagay na lang natin as, I don't know, I just don't like the negative of mental health problems. Siguro dapat mental health issues. That's all.
Thank you for that, Ma'am Gloria. So the suggestion is to basically include road traffic injuries, tama po ba? Yung word niya, road
RTI yan may program, tama yan po, sir. Merong may program na road traffic injury prevention, RTI yan
road traffic.
Yung lifestyle,
Hindi yan nabibigyan ng pansin. In fact, napapansin ko yan lalo every time I sign the death certificate, nadadagdagan pa, pumunta ng ospital na COVID pa. So COVID na, road traffic na disgrasya pa. So
anyway, let me just comment. I'd like to update Dr. Fabregas na meron po tayong pinondohan na study on mga injuries. Kasama po yung RTI na yan, traffic injury, pero hindi pa lumalabas yung result. Yung ginawa po ni Dr. Ayuson, pumapasok siya doon. Pero kasama yung ibang injury din na hindi lang specific for road traffic injury. Yung lifestyle diseases, I would prefer it to be lifestyle-related diseases. Kasi yung program, hindi naman lifestyle diseases eh. Lifestyle-related diseases.
Health, yan? Actually, meron pang healthy lifestyle-related diseases. To be, if you want it.
Tama siguro si Doc, healthy lifestyle. Tama ba yan, Doc? Healthy lifestyle yun?
Healthy lifestyle. Kasi if you want to be correct, dapat consistent din tayo kung paano tinatawag sa national at sa regional.
Yun healthy lifestyle-related diseases.
So there are suggestions. So one is to include road traffic injury. I-float ko lang po yung question ko dito. Are we not considering other injuries or accidents? For the mental health problems and issue, might as well, do we want po ba na mental health na lang rather than problems, lagyan ng problems or issues? Lastly po, healthy lifestyle related diseases. The two terms, healthy and diseases, is basically contradicting. Based yata po on issue 1 says it's more of lifestyle related diseases, not healthy lifestyle related diseases. So, meron po ito sa part ng wellness, yung contradicting.
I'm going to check.
Apo. Yung healthy lifestyle related diseases is basically the usage of more supplements sa pag-maintain ng highest level of functioning or wellness. Kaya po may ganito rin naman po na topic. So, yun po. So first question po, do we want to stick sa road traffic and injury, or do we want to have yung nasa NURA na injuries and accidents, preventable injuries and accidents, and then mental health po ang nasa NURA, ang nasa atin po ay mental health problems, ang suggestion naman po is issues. Sa inyo po, ano po ba ang pleasure ng region?
Okay lang siguro wala ng problem. Mental health as a whole na lang.
Tama yung I would also prefer yung sa NURA din.
Thank you. How about sa road traffic injury?
I would prefer also the NURA kasi sub-component lang yung road traffic injury doon.
So, component lang ang...
Hello, Dr. Teddy?
Yes, ma'am. Nurse po ako, ma'am. Ted na lang po.
For the injury, so we will now make it as a whole. So that I just want to be clarified, included ba rito yung mga poisoning et al?
Yes. Sa NURA po, included po siya
So,
dito.
kasama toxicology and all these things.
Yes, kasama po siya dito. Isulat ko na lang siguro para may specific na lumabas. Toxicology, poisoning, traffic injury.
Sir, yung traditional medicine and traditional health and alternative medicine, nasaan ba dito?
Ito po.
Yung sa PITAP. Ito pala. Nabubulag ako
Opo. So, basically po sa NURA natin, hindi po siya nakalagay traditional and alternative health medicine. To increase our competitiveness as Filipino people, nakalagay po sa NURA natin Filipino traditional and complementary medicine or alternative medicine. May connotation sa PITAC at tinanong din po natin yung DG dito, ano po ba yung proper term? Is it complementary or alternative? Pag sinabi kasing alternative, parang nakikipag-compete siya sa Western medicine. So the suggestion was to make it more complementary medicine, and Filipino traditional and complementary medicine po ang suggestion. So what's the take po of the region regarding this po? Wala po. Okay.
I think mas maganda yan kasi parang yan ang yan ang nasa program eh. Hindi naman complementary medicine ng
Okay, noted po.
I would prefer that one.
Thank you. Si Sir Nap, sabi po niya, healthy, contradicting, confusing po siya. So basically, Sir Nap, kailangan po bang may isang matanggal dito or tanggalin po ang healthy? What's your take po, Sir Nap?
Hello, good morning po again. I think okay na po yung lifestyle related diseases or lifestyle related diseases po. Para sa akin po. Thank you.
Ma'am Gloria, is that okay po ba? Because this is your
excuse me sir, or maybe meron din naman di bang topic on wellness or something, healthy lifestyle, researches for healthy lifestyle, something like that, para hindi po siya confusing. But we are more focusing here on lifestyle related diseases, right po ba?
Sa
Thank you.
healthy lifestyle po, just to answer you po, based on the NURA, it will fall under health behaviors. Hindi po siya pinangalanan na healthy behaviors kasi there are behaviors that is unhealthy. So, meaning po ng health behaviors sa NURA ay behaviors that will affect your general health and wellness.
Thank you, sir.
Thank you po. So, ibalik ko lang po yung tanong sa ating proponent for the healthy lifestyle related diseases. Ma'am Gloria, is that okay po ba? Dr. Lim, seconded po na lifestyle diseases. Sir, Dr. Lim, wala na pong related?
Yun nga, i-edit ko sana, Sir Ted, na lifestyle-related diseases. O hindi ko na-edit dito sa chat.
Noted on that po. So,
Okay, thank you.
we'll take po dito. So, it's 10:43, last 2 minutes to finalize, and we will vote in every dito topics po na ilagay.
Sir, excuse me po.
Ted, parang may concern yata dito sa chat kay Ma'am Rose of EVHRDC. Pakibasa po.
Asan ba?
Yung effect ng pesticides and other chemicals.
Kasama po siya dito sa preventable injuries and accidents. Apo, kasama po siya doon.
Sir, meron kasi kaming yung geriatrics, pwede bang lagyan din ng geriatrics and palliative care?
Yes, sir. Thank you, ma'am. Yes, thank you, ma'am, for that. So there's a suggestion po for, this is the last na lang po siguro, for the geriatrics and palliative care. Do you agree po ba dito? For geriatrics and palliative care? Or any dissent sa pag include ng palliative care? Okay, mukhang wala naman po. Meron po ba? Okay, agree. May nag-second po ng inclusion of palliative care. Actually, that's one of our project dito sa JBL, and we will roll out to every region the training for basic and palliative care and even the intermediate one. So with that po, Sir Raymond, na-move po ba yung health economics? Shall we add it back? Nandito na po siya, financing and economics po.
Sir, another lang, would you mind specifying the OMIC technologies dyan? Pwede ba yun?
Kasi nandito naman, sir, ito OMIC.
Hindi, yung sakop ng OMIC technology. Pwede ba, what do you think? Kasi katulad ng health systems, in-enumerate natin para for the general public. Hindi naman nila maintindihan ng ibig sabihin ng OMIC eh.
Dali lang po Ang kasama po dito, mga example lang po, yung mga genetics. Ano pa yung nakasulat doon? Genetics, genomics studies, and molecular studies. Genetics, genomics, and molecular studies. Bodies. Yan po, yung mga naka-provide sa inputs doon.
Yeah, mas maganda kasi pag ganyan para maintindihan.
Noted on that po. Doon po sa sa final document, we will include po explanation ano yung inclusion nito. So basically, time is up for the appeals process. So later po, after po ni Sir Raymond, ready ka na ba? Si Sir Raymond po magpo-poll po sa atin whether or not we agree sa bawat topics na nandito. So basahin ko lang po to buy time po kay Sir Raymond. First, we have health technology and development. Second, we have disaster risk reduction and health emergencies. Third, we have food safety, then followed by functional food, geriatrics and palliative care, health behaviors, health systems development and universal health care, health promotion, health research management, ICT for health, communicable diseases, which includes emerging and re-emerging diseases like COVID-19, maternal, newborn, and child health, mental health, lifestyle-related diseases, nutrition, occupational health, omic technology, reproductive health and family planning, school health, and traditional and alternative medicine. And lastly po, preventable injuries and accidents that will include toxicology, poisoning, and traffic injury. So with that po, I'll unshare lang po, and Sir Raymond or the Secretariat, kung okay na po ba?
I think, Sir Teddy, since we need to update the poll because of the changes, we need some time to make some edit. If I can suggest for like a 10-minute break just to complete the changes, and then we can come back after 10 minutes.
Okay.
Video.
So Secretariat po.
All right, so is it okay if we go for a 10-minute break?
Pwedeng magtanong na lang muna.
Yes, sir.
Sir Ted, di ba we were discussing, somebody raised about niches or specific research question under each team.
Yes, sir.
Do you advise us to hold another setting where we can put the specific niches already?
Actually, sir,
from the final research agenda that we have, that we will generate?
Actually, sir, dito, mailalagay naman na po natin siya kasi po may 150 profiles. Kailangan lang po nating i-check kung ano po yung under nun na mga topics or specific research questions.
Meron na kayong what do you mean na may lalagay? Ayun kami, may update na lang namin, maglalagay na lang kami doon, ganun ba?
Hindi po. Pag natapos po namin nila Sir Raymond yung analysis and even yung updating po, maisasama o maisusulat na po namin yung mga specific topics na kasama po ng ating nakasama dito sa ating research agenda.
Okay, but we usually do that kasi in an activity like this ba na ganun kasi yun po yung ginawa namin last year na kasi before you were invited, ganun po yung ginawa namin na so
pero yes sir, pwede naman din, maganda rin po yun. It's the call of EVHRDC kung paano nyo po i-finalize yung mga research topics para po doon.
Okay, thank you.
And alternative. Sir Raymond, wait lang po. I-send ko sa iyo yung i-update. Ito, sinusulat ko lang. Tapos, insert. Oops. Then, injuries and accidents. Accidents. Okay. Okay. Delete. Okay. Okay. Hmm. Okay, I'll share it again, Sir Raymond. Okay. If you can see po, dito, hindi pa po natin sinasabi siya ay Regional Unified Health Research Agenda. Why? Because basically, in our guidelines, it should be vetted by the stakeholders through an objective way. So, iisa-isahin po natin ito sa pag-vet na nag-agree po tayo sa ating topics. So mamaya po in an objective manner, Sir Raymond will cast a poll and then that poll will serve as a basis and a screenshot po nila ito. So if you can see po, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 20 research agenda. Nabawasan ng isa, pero as mentioned, wala dito ang disability kasi pumasok na po siya sa mental health or child health if ever, and also yung GAD or gender and development na studies. So with that po, we have 20 for voting. And then that 20 will be voted na isa-isa po later. So Raymond and the Secretariat, baka po meron tayong mga para sa voting later. Thank you. Have we considered the study on the participatory role of local stakeholders, community households in the promotion and health RDE? Ma'am Ophel, yes po, nakasama po siya. Actually, action research po iyon na pumapasok and that's basically part of ating health behaviors and also health governance. That was also tag dito sa ating tag po sa ating priorities na pumapasok po siya sa dalawang thematic areas. So Secretariat po, please let us know, please let the stakeholders know kung tayo po ay ready na for the polling. Marami pong salamat.
Right, I believe Mr. Campo is still working on the poll. So we're gonna be doing it using the Zoom poll this time po. So again, for the information of everyone, we have posted the attendance sheet in the chat box. So please fill it out. And later on, we will also be posting the customer feedback form, and we also need you to fill that out. For those who are asking for the copy of the presentations yesterday and today, we will be finalizing the presentations and share it with you probably on Monday. Of course, also the result of this consultation will be sent out on Monday. So Raymond, just let us know if you're ready with the poll. I'm sure Raymond already prepared this last night. However, because of the changes we had during the appeal session, he has to edit it and finalize it for you. Let's just give him a few more minutes to finalize it, and we'll start with the poll.
April.
Yes, Sir D.
April.
Yes, Sir D.
Maybe you should place dito sa baba, Regional Unified Health Research Agenda, RUHRA. Kasi walang unified eh.
Oh, okay. Sir Teddy, Sir Dean is suggesting to add unified, so it should be a Regional Unified Health Research Agenda.
Thank you for that comment, Sir Ding. So basically, before we call it Unified Health Research Agenda, every topic should be vetted after the first poll, and then yung magiging sunod po na presentation deck is magkakaroon na po siya ng unified kasi po napagbotohan na po siya na yes po na ina-accept ng bawat stakeholders ang bawat topics na meron po dito. So for now, sir, based on the guidelines, it's Regional Health Research Agenda. This is the proposed one. Pag napagbotohan na po natin, tsaka po natin lagyan ng unified. Maraming pong salamat.
Yes, sir. Sige. Thank you. I agree po.
All right. Thank you, Sir Dizon, for clarifying that. Right now, Raymond is still changing or editing the poll. So in the meantime, we will let you watch an institutional video. And once ready, we will proceed with the poll. Thank you.
The Philippine Council for Health Research and Development has invested in research and innovation, in people, in infrastructure, and in support systems to create an enabling environment for health research in the country, to generate innovations and solutions to our pressing health problems.
Created in 1982 as a sectoral council of the Department of Science and Technology, the PCHRD is mandated to coordinate all health research in the country. In 2013, the passage of Republic Act 10532, or the PNHRS law, further strengthened the PCHRD's leadership role in the Philippine National Health Research System as the national coordinating body for health research. The PCHRD has grown and expanded its services in the areas of agenda setting, research management, capacity building, research dissemination, translation and utilization, resource mobilization, and national and international collaborations. The Council, together with the Department of Health, the Commission on Higher Education, and the National Institutes of Health of UP Manila, sets the national agenda for health research. It does this by formulating the 6th-year National Unified Health Research Agenda, or NURA, which guides researchers who are seeking research funding. This national agenda-setting exercise was cited by the Council for Health Research and Development in Geneva as a model for low to middle-income countries in 2006. Within the NURA and the Harmonized National R&D Agenda, the Council supports collaborative research on drug discovery and development, omic technologies for health, functional foods, nutrition and food safety, dengue and other arboviruses, diagnostics, mental health, biomedical engineering and health technologies, information and communication technology for health, and disaster risk reduction and climate change adaptation for health. In other areas of the research agenda, the PCHRD teams up with the Department of Health, in managing its health systems and policy research, and with the Philippine Health Insurance Corporation on healthcare financing. These partnerships augur well for the implementation of the Universal Health Care Act. The PCHRD promotes health research ethics as the country's commitment to the protection of the rights, welfare, and well-being of human participants in research. Together with the Philippine Health Research Ethics Board, or PHREB, the highest policy-making body for ethical issues in human health research, the Council aims to strengthen institutional ethics review boards from registration to accreditation. Generated from the funded projects of the Council were important healthcare policies, products, and services. Even before the passage of the Technology Transfer Law of 2009, the Council already undertook technology commercialization, which seeded the growth of medicinal plant products in the country. Lagundi for cough and Sambonga's treatment for kidney stones are now household names. The Council's support for a dengue diagnostic kit led to the creation of the first startup company out of the UP system. Now the award-winning biotech M-Aqua kit is available in the market with sensitivity and specificity comparable to the standard test, but at a much lower cost. The Council's experience in technology transfer show the importance of the private sector as a partner. In 2012, the PCHRD was the first council that invested in a joint research with the industry through the Orthopedic International Incorporated. This joint research led to the Access Knee System for arthritis, which is now used by orthopedic surgeons for patients needing knee replacement in the country and soon in Asia. Built for Filipinos and other Asians, the Access Knee System cost 40 to 50% lower than what's currently in the market. With health innovations in the pipeline, the Council is, at the same time, building the capacity of research institutions and researchers to make sure that research projects are technology and industry ready. Research for evidence-informed policy making is an equally important path for our research outputs. Our supported researches contributed to the development of the expanded program on immunization, the Newborn Screening Act, the National Health Insurance Act, the Philippine National Health Research System Act, the National Integrated Cancer Control Act, and the Universal Healthcare Act. The PCHRD established the country's first online databases and information services through its Health Research and Development Information Network platform of Unified Research Information Management Systems, or HERDIN+. It is the only national health research repository containing more than 60,000 records. This resource is linked with the Western Pacific Region Index Medicus and subsequently the Global Index Medicus. The expertise that the Council developed in online databases allowed it to come up with a clinical trials registry with the Food and Drug Administration and an online project management system. To ensure that the country has a cadre of researchers who will undertake needed researches, the PCHRD provides scholarships, research fellowships, and other assistance for capacity building. The PCHRD is also developing a new crop of clinical researchers through our MD-PhD program and Masters in Molecular Medicine. The pioneering MD-PhD program is the only degree program in the Philippines that combines the features of MD and PhD courses in one, offering a unique opportunity for some of the best and aspiring young Filipino scientists to train for careers dedicated to the advancement of health through biomedical research. The Council's research fellowship programs are opportunities for collaborative R&D and capacity building for Filipino researchers through partnerships with leading research institutions worldwide. There are also incentives for young researchers to go into research careers. Likewise, recognition is given to mentors who share their expertise with beginning researchers. Equity in development. This is what PCHRD had in mind from its inception. In 1984, the first regional research consortium was formed. To date, each of the 17 regions has a research consortium, including the Bangsamoro Autonomous Region in Muslim Mindanao Health Research and Development Consortium. The idea is to capacitate each region towards self-determination in health research, thus increasing the country's research pool and research productivity. One feature of the regional consortia is the Regional Research Fund. This is a strategy of the Council to encourage new researchers to be actively involved in health research activities without having to compete with more experienced researchers. RRF projects are intended to build the capabilities of researchers in designing, implementing, and managing health research projects.
This is very consistent with our goal or our program of expanding our R&D base, our R&D pool, particularly spreading it across the country, so that these research institutions located in various parts of the country can take up the challenge of addressing the needs in the region and also taking advantage of the opportunities that are available in the region.
Technology transcends nation-state borders. The Council sees integration of economic blocks, such as our own ASEAN, as one economic community. Over the years, the Council has slowly built its partnerships with international organizations and programs. Among these are ASEAN Network for Drugs, Diagnostics, Vaccines, and Traditional Medicines Innovation, the Regional Platform for Collaborative R&D among the member states of ASEAN in collaboration with the World Health Organization TDR, the Special Program for Research and Training in Tropical Diseases, Newton Agham Program, E-Asia Joint Research Program, Southeast Asia-Europe Joint Funding Scheme for Research and Innovation, and ASEAN Science and Technology Innovation Fund. The Council also has partnerships with some of the world's leading research institutions, such as the United States National Institutes of Health, the London School of Hygiene and Tropical Medicine, Mayo Clinic, Harvard University, and Massachusetts General Hospital, among others. What sustains a health research system is communication. With this in mind, the Council maximizes the use of traditional and new media. Partnership is employed as a strategic approach. Partnership with media, partnership with the regional consortium's communication teams, and partnership with everyone who shares the Council's vision.
The DOST PCHRD is composed of professionals who are up to their game and know exactly what the country needs for the health sector.
Decades may have passed, but the PCHRD's mandate remains the same. PCHRD, making your life better.
Hi, Ma'am April. Kamusta po si Sir Raymond?
I just checked on him po. Wala pa po siyang ano. I think he's still working on it. I'll try to call him po. Just give me a few minutes po.
Noted
Just
po.
done po.
Ay,
We're
there
done.
you have it.
Check ko lang po kung nag-show na yung changes. Okay, so we're good. So I think it changed to 22 health research
20.
topics.
20.
20 po?
Oo. So wait lang ha.
Parang 22 po yung
sige, tingnan natin.
Screenshot ko po.
So basically, we have this po na research agenda. 1. Health technology and development, disaster risk reduction and health emergencies, food safety, functional foods, geriatric and palliative care, health behaviors, health systems and universal health care, health promotion, health research management, ICT for health, communicable diseases, innovations in health, maternal and newborn child health, mental health, lifestyle-related diseases, nutrition, occupational health, omic technologies, reproductive health and family planning, school health, traditional and alternative health medicine, and preventable injuries and accidents. Ito po yung pagbobotohan natin para sa posting so that we can call this as Regional Unified Health Research Agenda that is updated.
So, bali it's 22 po.
Yeah. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22. Tama.
Ay, opo. Okay. Kasi po yan yung punas. Okay po, I'm good. We can start po the ano. Just let me know.
So everyone po, we are now down to our voting of each of the research agenda. So meron po tayong poll dito and Sir Raymond will cast the poll or launch the poll so that everyone po can provide their inputs. You may disagree or you may agree depending on your perspective po or your side. Now po dito, anonymize po ang mga tao na mag-vote because we wanted to protect your identity especially when we are dealing with all of this. So with now for the first research agenda, health technology and development. So ito po, pasabi na lang po kung kayo po ay nag-a-agree or nagdi-disagree sa mga topics na nandyan. So 1 to 7 lang po muna or 1 to 15 po muna ang pwede po nating sagutin. Tapos yung susunod po, i-launch uli ni Sir Raymond. So the question is, do you agree the title of the research agenda is a priority of the region? So no worries kung kayo po ay nag-no or nag-yes. Kasi po, ito naman po ay anonymized. Hopefully, everyone can provide. So we are now on the 40% voting. Hopefully, everyone can provide their answers. 6 pa lang po ang nagka-cast ng answers and we are 19 here. Baka po ang secretariat din, they can also provide your answers. We have 60% vote in. And then for transparency purposes, we will let you know kung ano po ang result ng bawat research priority. %66% in. We're running 2 minutes na po for the voting. Okay. Siguro 3 minutes, another, 1 minute. Sana po lahat po ay makaboto. May 10 na po tayong bumoto. Meron pa po tayong iniintay na sabihin na natin 5 pa. Yung mga hindi pa po nakapag-cast ng vote, hopefully you can provide your votes. You can click po yung sa poll po para po mailagay po natin. Okay. So Raymond, 30 seconds more. And then pa-end na lang po, exact na 4 minutes for the voting. Oops. Yes, poll question 1. Okay, and the poll now is closed. And then please share the results of the poll. Okay, if you can see, unahin po natin, health technology at 90% agrees. Disaster risk reduction and health emergency, 90% agree, 100% agree. Food safety, 90% agreed. 50-50 for functional food, 90% for geriatrics and palliative care. Health behaviors is 80%. And then health systems development and universal health care is 100%. So for the next set, Sir Raymond, please launch the poll for the next set of priorities. So now we have health promotion, health research management, ICT for health, communicable diseases, including emerging and re-emerging diseases, innovations in health, maternal newborn child health, mental health, and lifestyle-related diseases. Paano maka-join sa voting? Maglo-launch na lang po siya, ma'am. Pakipindot po yung poll dyan sa inyong pinakababa ng screen kung hindi pa po siya nagpa-pop up. Siguro Ma'am Rose, baka po pwede nyo i-type in po yung inyong answer dito and the secretariat will have it recorded.
Daddy S.
Okay, we have 3 minutes more or 2 minutes 30 seconds. Okay. I think 82% voted na. Nawawala kasi connectivity ko. Yes, ma'am. Please cast your vote na lang din po sa chat box if nawawala po tayo so that maka-catch up tayo. So that the secretariat will take note of that po. So, Sir Raymond, I think with the, ilan ba ito? We have 82% vote in. We have 1 minute 30 seconds to cast our votes. Okay, 1 more minute for voting po. Okay, priority din ang health tech and development and disaster-related issues. Thank you, ma'am. So Raymond, baka we can close. Please close now and share the results. So I'll be reading. Health promotion, 92% agrees. And then health research management, 85%. ICT for health, 100%. Communicable diseases, including emerging and re-emerging diseases like COVID-19, 100%. Innovations in health, 100%. Maternal newborn child health, 12%, 92%. And then mental health, 100%. And then lifestyle-related diseases, 108%. So actually 100% ito. So stop sharing, sir. And then the third set of our poll, Sir Raymond. So next, for the third set, we have nutrition, occupational health, omic technology, reproductive health, school health, traditional alternative health medicine, and preventable injuries, accidents. Hopefully, everyone can provide their voices by casting their vote. So actually, mukha na itong practice of our right to suffrage para sa election yata. Okay, 35%, 41% casted their votes. We use po poll na lang sa Zoom because we saw that there is a low utilization for the Mentimeter, so everyone can participate using the poll ng Zoom. Okay, 52%. Siguro if we can reach 14, we can close na. And then si Ma'am Rosa, health, nutrition, occupational health, omic technology, reproductive and family planning is also a priority. The Secretariat will note of the priorities mentioned by Ma'am Rosa. Okay. 1 more minute. Okay, 30 plus seconds more before closing. We have 64% in. Okay, mga 15 seconds na lang po. Okay, 5 seconds more. Okay, please close the voting poll. And then I'll read na lang po. Please share the results. first result, nutrition, 91% agree. Occupational health, 100%. Omic technologies, 82%. Reproductive and family planning, 100%. School health, 82%. Traditional alternative health medicine, 73%. And lastly po, preventable injuries and accidents, 91%. So with that, please close po muna yung ating sharing of results. So with that po, we can declare this as the updated this year, 2021, the Regional Unified Health Research Agenda. So moving forward with our prioritization, last 2017, the Regional Unified Health Research Agenda 2017 to 2022 of Eastern Visayas was prioritized based on the following criteria: public health impact of 35%, feasibility of 30%, ethical acceptability of 20%, and collaboration of 15%. So all of these criteria po has weights. So ito po yung 35, 30, 20, and 15. And based on the guidelines, we will be using the same criteria for percent of na RUHRA na 6 years. So para po mas madali nating ma-monitor. Lahat po ng scores na ibibigay natin sa prioritization, is it a yes or a no lang po, and then we will code that 0, 1, 2, and 3. Tapos po, bibigyan po natin ng scores, and then magkakaroon po tayo ng weighted score. We will compute that po, and then the total weighted score will be the basis of the ranking. So again, we have public health impact, 35%, feasibility, 30%, ethical acceptability, 20%, and collaboration, which is 15%. Now, all of this po, isa-isa pa rin po natin bibigyan ng score ang lahat ng ating research agenda. So without further ado, so Sir Raymond will launch the poll after I explain this process. So basically, each and every one of you has a voice, individual scoring per criteria. So 4 na rounds po tayo na mag-vote for the 22 research priorities. And then we will post po muna preliminary results, meaning we will share the results with you. Yung results na po na yon ay wala pang ranking at wala pang analysis. And then, yung sinasabi po nating dissemination by the EVHRDC, yun po ay may descriptive statistical analysis na ng raw scores from you. So basically, malalaman po natin ang ranking, although yun po lahat na 22 ay priorities, meaning po irarank lang po natin siya dito for the purposes of prioritization. So the steps again is deciding on what research are our priorities. With that po, Sir Raymond, please open the poll for our first set. So again, ito po. Ang question po dito, do you think that the name of the research topic has a high public health impact? When, like for example po, pag sinabi natin high public health impact, kapag nagumaba po ba tayo ng research related to this, will it impact more general public and the public health and towards better health outcomes and universal health care? So mga ganun po yung sinatawag nating high public health impact. You can take po na I am not sure. If you are not really sure whether or not that topic will have a high public health impact kapag nag-conduct po tayo ng study na yon. And if you disagree that it has high public health impact, you can also do so.
Sir
So,
Ted, I have some clarifications lang to make
yes, sir.
concerning po ito. I just want to be honest to everyone na we received a directive from the central office to prioritize from the DOH funding yung universal healthcare research. Kasi this is what I was telling the group earlier, that there are research questions that were prioritized for funding by DOH, and even actually we discussed it with the EVHRDC. And I don't want to preempt this survey because maybe that will not come out to be priority here. But whatever is the result, the universal healthcare research priorities will be prioritized really by the DOH. Just for the information lang of everybody, because of the directive, we received already two memoranda, and in fact, Sister Hospital, EVHRDC, and some of the other institutions were already submitted the proposal. So yun lang po ang ko para kasi pag lumabas dito sa sa criteria nyo na hindi siya lumabas number 1, and then later on other researchers will find out na hindi siya naging first priority. Bakit pinunduan nyo? Hindi naman yan naging first priority sa agenda setting. So yun po yung clarification na sinasabi ko po at this time.
Opo. Thank you for that. So there are several priorities po for the Department of Health. They wanted to prioritize yung universal healthcare, health systems development na topic. For DOST, I think their priority for 2019 and 2022 are those presented yesterday. That includes diagnostics, also omic technology, ICT for health, disaster resilience, functional food, and ICT for health, and disaster risk reduction and health emergencies. So for the Department of Health, that's universal healthcare and health systems development. So we have 41%. Hopefully everyone can provide their answers or inputs. And sana po malaman natin talaga kung ano yung priorities. We will compute pa rin po so that we can objectively identify whether or not it's a priority of the region. Although lahat naman po ng nandito sa updated Regional Unified Health Research Agenda ay priority, all of our priorities, ano yung dapat nating unahin na may high public health impact. So it's up for the stakeholders to really identify. We have 52%. Siguro dagdagan pa natin. 30 seconds more. Sana po makapag-provide pa ng isa pang answer. So si Ma'am Rosa, yes. Number 1, palagay na lang din po, Secretariat. Number 2, yes. Number 3, yes. Number 4, I am not sure. Number 5, yes. Number 6, yes. Number 7, yes. Very much top high priority. So, Sir Raymond, please close the voting poll and please share the results. I will just read this. So for health technology assessment, 75 acknowledge that is a high public health impact. And then disaster risk reduction, no doubt, 100%. Food safety, 75% na nag-yes. Functional foods, 42% nag-yes, 42% nag-no, and 17% nag I am not sure. Geriatrics and palliative care, 75% ang nag-yes. Health behaviors is 92%. And then universal healthcare is nag-100%. Please stop sharing the results. We will proceed with the next batch of priorities. Okay, the next batch of priorities for public health impact criteria. Number 1, health promotion. 2, health research management. 3, ICT for health. 4, communicable diseases, including emerging and re-emerging diseases such as COVID-19. Next, innovations in health. Next is maternal and newborn child health. Next, mental health. Next is lifestyle-related diseases. So let's have 5 minutes for the voting. For Rinat po, meron na lang tayong 3 sets of voting for the next 3 criteria. So mga 15 minutes na lang and we can end the session and I'll turn over to Secretariat. So we have 47% in our voting poll. For those who cannot join the voting, you may use the chat box functionality to provide us your answers. But basically po, hindi po namin ma-assure ang inyong anonymity kapag sa chat box unless you direct it to our secretariat and we will just read it. So we have 52%. 2 minutes, halos 2 minutes na po ang nako-consume for the second round for public health impact. Okay, reading, Ma'am Rosa, yes. Number 1, number 2, yes. Number 3, yes. Number 4, yes. Number 5, yes. Number 6, yes. And number 7, yes. And number 8, yes. So all of Ma'am Rosa's answer is yes. So basically, we have 10 na nag-provide na ng answers. We have 2 minutes, 30 seconds left for answering. Sana po yung iba makapag-provide pa ng kanilang answers so that balance po ang ating scoring. Okay, 2 minutes left. Okay, we have 58% plus 1 from the chat. Okay, 10. Sir Raymond, baka okay na? Okay, thank you, sir. Sharing with you the results. So health promotion, 80%. Health research management, 80% nag-yes. ICT for health, 90%. Communicable diseases, 90%. Innovations in health, 70%. Maternal, newborn, and child health, 80%. Mental health, 90%. Lifestyle-related diseases, 100%. Please unshare the results and then we proceed with the next polling. Please launch the third poll. So for the third poll, for the same criteria for public health impact. Number 1, nutrition. Number 2, occupational health. Number 3, omic technologies. Number 4, reproductive health. Number 5, school health. Number 6, traditional and alternative health medicine. Number 7, preventable injuries and accidents. So all of this will be checked for the criteria of public health impact. Okay, we have 6 now, 7. Kapag tayo po ay mabilis din mag-cast ng vote, at least maka-10 tayo, we can proceed sa ating next na criteria. 9. 47%. Hopefully, there's one more. Yung paggamit po ng ating chat box, you can use that if you cannot provide answers using the poll. Okay. Sa chat box po ba meron? Okay. So Raymond, we can now close the voting and share the results. Sharing with you the results. Nutrition, 92%. Occupational health, 83% na nag-yes. 58% ang UMIC technologies. Reproductive health is 92%. School health is 67%. 67% ang traditional and alternative health medicine. And then preventable injuries and accidents. Please stop sharing the results and we will proceed with the next criteria. The next criteria po is our feasibility. So feasibility na ang i-check natin, which is 30% ang weight. So Sir Raymond, please launch the poll. Ito na po yung poll for feasibility. Do you think the region has the capacity or is it feasible for the region to execute or conduct researches related to the following research agenda? Number 1, health technology and development. 2, disaster risk reduction and health emergencies. Food safety, functional food, geriatrics, health behaviors, health systems and development, and universal healthcare. Do you think kaya po ba ng region mag-conduct ng ganyan na researches? So we are still waiting for the others to cast their votes. You can always use the chat box to provide your answers and the secretariat will just record it. Okay, at least 2 more vote. Okay, let's see. Okay. So Raymond, please close the poll. Please share the results. So for this health technology, is it feasible? So yes, 55%. Disaster risk reduction, 91%. Food safety, 82%. Functional food, 64%. Geriatrics, 82%. Healthy behavior, 73%. And then 82% health systems development and universal healthcare. Please stop sharing and let's move forward for the next poll for feasibility. So the next round of research agenda under feasibility, health promotion, health research management, ICT for health, communicable diseases, innovations in health, maternal newborn child health, mental health, lifestyle-related diseases. So is it feasible? Kaya ba ng region with your current capacity to conduct those researches? So there's one in the chat box. Yes, for all Dr. Abiertas. Okay, so Raymond, please close the voting poll. Let's share them the results. So, sharing the results now for health promotion, 91%, research management, 82%, 100% for ICT, communicable diseases, 100%, innovations in health, 91%, maternal newborn child health 100, and then mental health 100, lifestyle related diseases 100%. So let's move to the third set. So we have under feasibility category. So nutrition, occupational health, omic technologies, reproductive health and family planning, school health, traditional health and alternative health medicine, preventable injuries and accidents. So, do you think kaya po ba ng region with your current capacity to conduct research related to that? Mukhang bumibilis ang pag-cast ng vote. 8. Okay. Let's wait a little bit longer ng konti. Okay. Okay, let's close the voting poll. Sir Raymond. Okay, sharing with you the results. For nutrition, 92%, occupational health, 75%, omic technologies, 50%, 100% for reproductive and health and family planning, school health, 92%, traditional and alternative health medicine, 75%, and then preventable injuries and accidents, 100%. Please stop sharing. And then we will move forward with the next set. Yun po yung pang third criteria natin. Ang third criteria po natin ay ethical acceptability. Meaning po nito, yung mga proposals natin, wala masyadong hurdle in terms of ethical acceptability. So number 1, health technology assessment, health technology and development. 2, disaster risk reduction and health emergencies. Food safety, functional food, geriatrics and palliative care, health behavior, health systems development. So, is it high ang ethical acceptability pag nag-propose po ba ang mga researchers? Mas mabilis na po tayo nakakapag-vote ngayon. So thank you for participating. We need 2 more pa po. Okay, please close the voting poll and then share the results. Okay, number 1, health technology 75, disaster risk reduction 92, food safety 83, functional food 67, geriatrics and palliative care 58, health behavior 75, and health systems development and universal health care 100%. Next set for the ethical acceptability. So for ethical acceptability, the next round will be on health promotion, health research management, ICT for health, communicable diseases, innovations in health, maternal, newborn, and child health, mental health, and lifestyle-related diseases. Ano po dito yung high ethical acceptability? You can use the chat box to provide your answers if you cannot participate in our poll. Okay. Yeah. So, Sir Raymond, please close the voting poll. Now, for the ethical acceptability again, health promotion is 100%, health research management is 90%, ICT is 90%, communicable diseases 90%, innovations in health 80%, maternal newborn child health is 100%, and mental health 50%, 30% I'm not sure, and 20% no. And then lifestyle related diseases 100%. So next round, Sir Raymond. For the next round, we have nutrition, occupational health, omic technologies, reproductive health and family planning, school health, traditional and alternative health medicine, and then preventable injuries. After this po, there will be one round na lang po of poll. I mean, one round of poll for all the collaboration na criteria. So please close the voting poll now. Okay, for the nutrition, we have 100%, occupational health 77, 69% omic, yung reproductive health and family planning 85%, and then school health 92%, traditional and alternative health medicine 77%, and preventable injuries and accidents is 100%. So stop sharing the results and then we will proceed sa collaboration. For the collaboration, meaning po ba, ang mga topics or questions or research agenda na ito is highly collaborative in nature. So number 1, we have health technology. 2, disaster risk reduction. 3, food safety. Then functional food. And then geriatrics and palliative care. Health behaviors, health systems development, and universal health care. Ito po ba ay highly collaborative in nature when we execute researches or propose researches? Sir Raymond, please close the voting poll and then please share the results. So health technology and development is 100. Disaster risk reduction and health emergencies 100. Food safety 91. Functional food 64. Geriatrics and palliative care 91%. Health behavior 82%. Universal healthcare and health systems development 100%. Let's proceed with the second poll for the collaborative. So I'll read again. So for the collaborative criteria, 1 is health promotion. Next, health research management, ICT for health, communicable diseases, innovations in health, maternal and newborn child health, mental health, and lifestyle-related diseases. Do you think is it highly collaborative when we execute or conduct researches? Okay, so Raymond, kindly close the voting poll. Okay. So we have health promotion, health research na 100%, health research management 82%, ICT for health is 91%, communicable diseases 91%, innovations in health 82%, maternal newborn child health 100%, mental health 73%, lifestyle related diseases 100%. Please stop sharing the results and we will move forward with the last set for the collaborative. So that the last set for the collaborative criteria, nutrition, number 1, nutrition. Next is occupational health. Next, omic technologies. Next will be reproductive and family planning. Next is school health. Next is traditional and alternative medicine. And lastly, preventable injuries and accidents. This is the last set for our criteria setting. Thank you for participating in this short survey, and EVHRDC will disseminate the results, and even I don't know kung they will disseminate the raw data for verification and or cross-checking. So kindly close the voting poll. Okay, we have now nutrition 100%, occupational health 92%, omic technology 75%, 100% po ang reproductive and family planning, and then school health is 83%, and then traditional alternative health medicine 92%, preventable injuries and accidents is 83%. So kindly close the poll na lang po. Paki-close na lang, sir. Okay, thank you very much. So with that po, again, we will use the individual score and the weight and multiply it with the weighted criteria, so we can come up with the weighted score of everyone and the total weighted score of every criteria and every research agenda na binigyan niyo po ng score ay i-rank po natin, and EVHRDC will disseminate the results. So our process is we do individual scoring per criteria, posting of the preliminary results, kaya po namin sinishare for transparency and accountability purposes, and then descriptive statistics will be done by us po so that we can compute everything. So again po, we wanted to be inclusive enough, that's why we have you as our stakeholders and gather information from you through surveys and also context, and to ensure inclusiveness. Now we generated 150 raw data and come up with 31 codes and come up with the final list po na nasa 22 na wala po doon ang disability at gender and development. That's why our final RUHRA po ay ito na. And yung ranking po niyan ay papakita na lang po ng EVHRDC. With that, I turn over the floor to EVHRDC Secretariat. Thank you very much.
All right, so there you have it. Thank you very much for your inputs. Yes, the appeals process took us too long.
May I ask a question muna for Sir Ted? Can I ask a question lang?
Sure, Ding.
Sir Ted, I was informed earlier that there are phases in research, health research agenda setting. So we did the preparatory phase yesterday. Today we did the implementation phase. What about the post-implementation phase? How do we conduct this?
That's a good question, sir. Actually, the post-implementation phase is usually done end of the year para po siyang program implementation review. Meaning po, ilan po ba ang napondohan na research sa isang buong taon, saan po siya naka-align na research agenda. Kasama rin po doon ang dissemination at also ang conduct of your review sa RAMSIN, sa technical, plus the monitoring of the REC ng mga researches.
Okay, sir. Thank you po. Another ano lang. Apparently kasi, EVHRDC is the major health funding source. But there may be some other sources of funding based on the research agenda that you presented. So, if maybe, would it be a good idea if we will also reach out to the other institutions and find out if they are funding? Does this refer only to funding of researches related to research agenda, or is that the case? Kasi yung EVHRDC, madali lang sa amin dahil nado-document namin. Paano kung may ibang institution na nagpondo na hindi namin alam? So, yun ang ibig kong sabihin na para ma-account namin lahat yung mga funded research.
What they usually do, sir, is basically they encourage member institution, especially EVHRDC, to inform the network, their network po, na i-upload sa HERDIN Plus ang kanilang mga researches. Nakasulat din po sa HERDIN Plus kung sino rin po ang nagpondo ng kanilang mga research projects. So basically, you can check on that on the HERDIN Plus. But at your level po sa EVHRDC lang mismo, you may want to ask your network members whether or not may na-conduct silang research related to your RUHRA so that you can count that as part of your output.
Huh? Oh, okay. Okay. Now, Sir Ding.
Yes, sir. Yes, sir. Po. Sige, sir. Sir Tony.
You're on mute po, Dr. Lim.
Sir, I cannot hear you po.
Okay. For this year, St. Scholastica's College, Tacloban did not ask for funding from EVHRDC. But actually, we have 3 researches that are funded by the St. Scholastica's College Manila Research Foundation. And we were granted already. Out of the 4 proposals that we submitted to Manila, 3 are funded already. And the money has been downloaded to our account this month already. So that's a good question.
Yeah, I think that's thank you for that comment, sir. Yun pong ibig kong sabihin kasi this is Eastern Visayas. So kahit hindi EVHRDC yung pupundo at maganda na nado-document natin tulad yung sinabi ni sir. Meron pa kong one important question lang na pumasok sa mind ko. Earlier, yung mga clinical, sir, yung mga clinicians na gumagawa din sila ng research like yung Eastern Visayas Regional Medical Center, na apparently, nanonotice ko na hindi pumapasok yung mga research agenda nila sa RUHRA. Anong comment mo dun sa kailangan ba pumasok sila or they have to be separated, yung mga clinical researches? What do you think about that?
For the clinical researches po, sorry sir, Dr. Lim.
Yes sir, yes sir.
Just to answer you po very quickly is it should be aligned with the NURA or RUHRA. To scope that as part of the output of EVHRDC, it should qualify 2 main criteria. Number 1, dapat po member institution iyon. Number 2, kung funded siya or non-funded, bigyan po natin sila ng assistance. For example, sa assistance is technical review or capacity building or ethics review.
Sir Ding.
Yes, sir. Sige po.
Insofar as Divine Word Hospital is concerned, you know that we have a training program for the medical residents. And one of the major requirements for the training program is that by the end of the residency, they should be able to present a research. So what we are doing in Divine Word Hospital is that we see to it that our researches that are approved for the medical residents fall within the research agenda of the region. And we always have medical residents who are able to finish a research during a particular year. So for example, last year, I think we had four residency research that were completed, and then 3 of them had already taken the board examination for specialization in pediatrics, and they have passed, something like that.
Okay, sir. Thank you.
All right, I think that's it. All right, so once again, thank you everyone for your inputs. Yes, the appeals process and the survey took us long, but it's all worth it. Clearly, 2 or more heads are better than 1. Thank you, Sir Teddy, for helping us finalize the agenda, and of course for being open to comments and suggestions. Well, that's this consultation is all about. With that being said, please allow us to present this certificate of recognition to you, Mr. Teddy Dizon, for serving as the consultant during the conduct of this activity, RUHRA consultation and updating with stakeholders yesterday and today via Zoom conference. This has been signed today by Engineer Ernesto M. Granada, Regional Director of DOST Region 8, and the EXICOM, who is also the EXICOM co-chair of EVHRDC. Once again, thank you so much, Sir Teddy. By the way, before we move on to a virtual round of applause, please, for Sir Teddy. So thank you so much again, Sir Teddy. All right, so before we move on to the last part of the program, may I request everybody to please turn on your videos for documentation purposes.
Sir Ted, ba't ang galing-galing mo?
Sir Ding, ano lang siya, tayo dito, kailangan lang nating sumunod sa guidelines.
Hindi, parang napansin ko, ang galing-galing mo talaga pag mag-facilitate yung mga ganito, even during our activity before.
Salamat po.
All right, so some haven't turned on their videos yet or their cameras yet. May I request everyone to please turn on their cameras? All right, so in 3, 2, 1. Okay. All right, so your pictures have been taken. Thank you so much. Also, if you haven't filled out the attendance in the customer feedback form, please do so. Okay, and now to officially end this activity, we have the RMC chair from the Department of Health, Eastern Visayas Center for Health Development, Mr. Leonido P. Olobet, to deliver a closing message.
Okay. First of all, I would like to thank all the participants who actively shared their ideas and showed interest in not only in research agenda setting, but apparently in health research as well. And we welcome that development. I would like also to thank personally Sir Teddy Dizon for really helping us in coming up with a more systematic, more scientific way of generating the Regional Unified Health Research Agenda. And rest assured, sir, that this will go a long way. And for now, I believe we can, for this year, we can actually generate baseline data for this based on the capsule proposal and full-blown proposal that we will receive for the EVHRDC, so we can easily tag them. Is this health system? Is this communicable disease? So we can easily develop our, generate our baseline data for this. And I really appreciate the way, the manner this research agenda was undertaken since yesterday. And I was so very happy since yesterday to see that really there were many participants who were really interested in sharing their ideas. And I believe the RUHRA that we have at NAP at the moment, 2021, is really a product of collaborative efforts. So from different sectors and stakeholders. So rest assured that this research agenda setting is not the only way by which we can reach out to you. We are always open for ideas, new ideas, innovations, so that we will be able to meet our vision being transformative. Transformative in the way that, meaning to say, we are really utilizing our research results, especially for policy, because a lot of our research are policy related. One of our difficulties, challenges at the moment is research related to the DOST trust on technology generation, because apparently that is our problem at the moment, our challenge. But at least since we have a lot of participants who were here, maybe they can share their ideas, or that there may be some institutions which we are not knowledgeable of, but are actually doing already technology-based activities. So this is a very good development for the EVHRDC. So in behalf of our Execom Chair, Dr. Exuperia Bisal Berino, and our co-chair, Sir Ernie Granada, I would like to thank everyone for actively participating in this 2021 Health Research Agenda setting. Thank you.
All right, thank you, Mr. Olabia, for that message. I agree, we are happy that we now have a more structured way of doing this activity and more stakeholders are participating. We will share with you the final output of this activity once we have it. And there you have it. Thank you and enjoy the rest of your day. Keep safe, everyone.
Bem, Daniel, mag-meet muna tayo before we end the meeting. Thank you.
Okay.
Sir Dean, you can join us, Sir Dean.
Yeah. You said that
The
it's
Eastern
the setting,
Visayas Health Research and Development Consortium would like to express its heartfelt thank you for attending this event.
Time out, everyone.